You're tuned to Evergreen Media Network. I am Cindy Schwartz, and this is the Patient Partners Podcast. Jeannie Roller's my co-host. Jeannie, today we are talking about infections that patients get in the hospital or in the medical facility, and specifically sepsis, and also specifically people that die from that and not from whatever the procedure or cancer or whatever kind of ailment that they had to begin with, but it's the sepsis that they acquired being in these facilities. Another unreal topic that this stuff happens, and what's the answer for it? I know maybe some of it is, we talk about these things. Jeannie, you and I aren't medical people. It's just people that we do talk with about this that have the experience, and that's how we get our knowledge in reading different articles and things like that and court cases and stuff that's going on. But one of the things maybe is why so many surgery centers have sprung up where you don't need to go to an actual hospital or that kind of thing, an OR, that may have put in the brakes on some of this. I don't know. I don't know any statistics about that. Maybe you do, Jeannie, but I know people that have died from sepsis that went in for procedures, specifically cancer, and they'd never died from the cancer. They died from the sepsis, which is a horrible disease. And we did interview, sadly, the little girl out in California that was totally misdiagnosed with that, and you die a horrible death. She was a younger girl, and you just die. It's a horribly painful, just awful. Well, I wouldn't wish it on anyone, the things that we talk about, a lot of the things we talk about, Jeannie. So you have more information on this.
Well, let me throw some numbers at you. It says from Science Direct, in the U.S., more than 1.7 million adults develop sepsis annually, resulting in 270,000 deaths and contributing to 1 in every 3 deaths among hospitalized patients. It is the most expensive of all inpatient disease states, with the costs in the U.S. exceeding over $57 billion annually. So those are some numbers. Now, I too had a distant relative. She went in for a knee replacement, and they did the knee replacement, but somewhere along the line, she caught sepsis in her bone and later died. And yes, it was a horrible death. I remember my mother talking with her and how much pain she was in.
Yeah.
And, it is. And Michelle's daughter, Jessie, I believe was only like 8 years old.
Right, yeah.
Hers was undiagnosed. Undiagnosed by the doctor, not treated. And,
And I do know another woman too that had a cesarean section and wound up getting sepsis and was on antibiotics and drainage tubes and the whole bit for months and months after she had that baby. And that was a local thing here in Florida. It was a local thing. I met her through some friends, but she said it was just horrendous to try to take care of your baby, and then here you are, with this blue-green goop coming out of you. She was just unbelievable. I don't know how the poor girl made it. I can't imagine. You had babies, Jeannie, I have, and I, just add that on top of it.
Yeah.
So what's the,
sepsis, can be pneumonia. Pneumonia is a form. It's very easily spread in a hospital. I don't know. I've heard of so many people getting pneumonia while they were in the hospital.
Yeah, that's true.
And, ways you can get it is they can carry it from patient to patient by not sanitizing their hands properly or even what they're wearing. If medical equipment isn't properly sterilized, and a lot of times in the past, at least, devices that have been called one-time use devices have been reused again.
Yeah, reused.
Yeah. Yeah. So people who have central lines, that is a big area too that you have to be very careful. Urinary tract infections is another acquired hospital infection. surgical infection site, meaning where they do the incision, something can fall in or something happens. Pressure injuries are also in this category. So, I mean, there's just a whole host of things. And, you have to wonder why this keeps happening, because they know it. And when someone presents, because I read an article not too long ago about a young man who was presenting at the hospital with sepsis symptoms, but they never treated him for it. And of course, then he died.
And that's what happened to Michelle's daughter.
So, there's a lady who had a heart cath done, and she got sepsis, but she made it. Fortunately for her, I don't know what the stats are on people who don't make it and people who do. I don't really know, but it is, to me, I've always heard, if you don't want to be sick, then don't go to the hospital.
Well, right. Yeah, it's kind of a joke, but it isn't a joke. You know what I mean? That's why I wonder if these surgery centers now are taking some of this away, making it safer, I guess is what I'm trying to say. I'm hoping that, but they're smaller, less patients, and you're in and out. It's just the day surgery. I don't know. We need to do some statistics or look some of that stuff up, because I wouldn't wish that sepsis on anyone. And you're right. It's a virulent thing, and it's it's out there. It's rampant. It's out there. So why is it happening? Some people say, they should open the windows in hospitals and not rely on the air conditioning system so much. That kind of thing, that maybe it's coming from that how is that sanitized, or the ducts or anything like that? I don't know. The ductwork.
When I had my C-section, I was laying there and I could see the dust flying down on me.
Yeah.
And I was thinking,
that's not a good look. That isn't a good look.
Yeah, that was not. And I was like, I hope this isn't a bad thing, because I could actually see the dust.
Yeah. So I wonder about some of that. Yeah, I mean, people make mistakes. We talk about it all the time. It's not like we're trying to beat up on all these people all the time, but I mean, what's the answer? If you know this stuff is causing different things, then let's do something about it. Is it going to cost more money to get this fixed? Probably, but I mean, is it really going to cost more money to get this fixed when this many people's lives are saved at the end? How much, what is it? Why is it about money if that's what it is? What is it?
Yeah.
What's the gist of all of this? Is it people are afraid to talk about it? Or are people embarrassed? It's like anything in life. Are you embarrassed about it? Well, the communication's the biggest thing to fix it. People make mistakes. They do. Companies make mistakes. Hospitals make mistakes. Doctors make mistakes. I make mistakes. But talk about it, fix it for the next time. Hopefully don't just turn a blind eye to it and say, we don't know anything about that. Beware, don't go to a hospital when you're sick. Ha, ha, ha. It's kind of silly.
Well, and Cindy, to me, with the people I have known, I think there needs to be better training, especially in the ER departments, to recognize the symptoms. That's a big thing. If you can catch it, you can usually take care of it. But, that's the thing. It's being missed a lot of times. And I think in another show, we're going to talk about ER departments. But that's the big thing. They got to catch it early and treat it. And they're not a lot of times doing that.
Mm-hmm. And what is the gatekeeper for all of this? There is. There's got to be a custodian department. I mean, I'm not trying to beat up any one section, but there's got to be checks and balances. This was done to that in this time frame and whatever, because it's people's lives. Let's get back to that. It's bad enough when it isn't, and stuff happens like to your car or something like that, or your refrigerator or whatever. That's one thing, but you're talking about people's lives. I mean, it doesn't get any more serious than this. So when are we all going to get serious about this and say, enough of this? This is what needs to be done, regardless of how much it costs, and what's the time frame that needs to happen continually for really good, clean care. On that note, stay listening to Evergreen Media Network.